Hello, Hannah Del Toro, licensed clinical social worker here. I have literally been trying to get this video out for months and months and months and months, and there is just always something in the pandemic or always something that seems to interfere, like getting the right sound or the air conditioner coming on or glitching somehow. So I'm hopeful that this will take. Um, I am doing my first video series on anxiety. So this is the intro to the anxiety series. And I have rethought how I want to do these videos. Initially, I was going to walk people through my favorite workbooks, like the Anxiety and Phobia Workbook by Edmund Bourne. And also there is the Self-Esteem Workbook by Schiraldi. That is another really good one. So there's a lot of workbooks that I recommend to clients and that I use in my practice. But I decided to take a different route because I thought about walking people through those in these videos would take considerable time. And then I thought about copyright issues and that I don't want to step on any copyright toes. And since they aren't my books, I feel a little weird about walking people through them, even with giving the caveat that I'm doing it through my lens and the way that I practice and that all therapists practice differently. So I decided to shift gears and sort of give what I would like people to know on each of these subjects and relationship with food or when it comes to self-esteem or various topics. So anxiety has always been the one that I wanted to start with. That's the one that I seem to work the most with in my own practice. And so I'm going to do this in a series of about 6 videos. Each one will be about 10 minutes in length, about 10, 15 minutes in length, maybe a little more, maybe a little less, just depending. And I'll sell those it's little for a very, very affordable cost, which would be like having a session with me, some of the information that I would give out in sessions. And kind of pieces together to package that way so that people have the tools that I would share specific to this information. And part of why I want to do this is because people are having a really hard time finding resources during the pandemic. And I want people to have something that they can watch or listen to that will hold them over until they find a counselor that's a good fit for them or until they're able to get into working with me. So I want people to have this information. And I thought this would be a neat format to use instead of just writing about it, to explain it in my words in this video format. So the 6 different topics that I'm going to do include, the first one I'm going to do recommended resources. So resources that I think are particularly helpful in working with anxiety. The second one is going to be therapeutic interventions. So ways that some therapists use some interventions, and all therapists use different interventions and use the interventions differently, right? So presenting some of the interventions for people to see, to kind of get a feel for, okay, cognitive behavioral therapy would be really helpful for me, or I really want to learn a lot about relaxing my body and getting my body calmer when I'm struggling with anxiety or panic attacks. The third one would be feeling your feelings in healthy ways. There's a lot of research to suggest that suppressed feelings lead to anxiety. So if people don't know how to be normal, naturally just have the healthy, normal anger and feel that in a healthy enough way and get support around that, sometimes that can become free-floating anxiety. So going into some of those issues. And then challenging anxiety. So the fourth one will be on challenging it. How do we talk back to ourselves in a compassionate, kind way? How do we talk back to that inner critic? How do we challenge that voice that tells us we have to do something perfectly, to be able to say, it's okay, you can just do the best you can. So that's kind of the cognitive behavioral piece, right? That's what we tell ourselves, part of it. And then comforting anxiety. So how to be super, super kind to oneself, essentially. And then the sixth one will be where to go with the information that's shared in this video series. So that's how this will be laid out. And this is, of course, the introduction to what I'm doing. So this is a particularly personal topic for me. Anxiety is. I've worked with it with clients for many, many, many years. And to share personally about me, I did the bulk of my own counseling work in my 20s. I had an incredible therapist who I loved and worked with for a number of years and did individual and group with, and really, really gained a lot of insight into myself, into healthy relationship attachments, all kinds of areas. So I really loved working with her, and I grew a lot. And one of the workbooks that I do use for anxiety, the Anxiety and Phobia workbook by Bourne, I got when I was working with her. It was like in the first or second edition. That was like the late 90s, maybe 1990s, so long ago. So 20 something years ago. And now it's in the 7th edition, and it's kind of fun to have the newest edition and go through it and see what's been updated, what's changed a little bit in that. So I learned then a lot of ways to manage anxiety and calm myself and calm my body and adjust my thinking. And so I really learned those techniques pretty well. And I've helped clients with those techniques. And December 2018, I had an event happen that really shifted the way that I work with anxiety. I was doing some of this before, but it really shifted after that. So it was December of 2018 that I got really ill and developed pneumonia and progressed into sepsis and then septic shock and landed in the ICU with a blood pressure that was very low and unsure if I was going to make it. And came out of that. I'm so incredibly grateful that I'm alive and still here and that I survived that. And within a few months, I found my way to an immunologist who I took some lab work to and ran some more lab work. And I learned that I have common variable immunodeficiency disorder, also known as CVID, CVID, sort of for short. So it's a primary immunodeficiency disorder. If you are at all familiar with The Boy in a Bubble with David Vedder, he was born when I was a kid, 70s, 80s, somewhere in there, and had severe combined immunodeficiency disorder. So that's one that's a little more well known because of how well The Boy in a Bubble story was known. And he had the most severe form, the severe combined immunodeficiency disorder, which thanks to a lot of great research coming from that, they're finding some amazing ways to cure that in babies and to help with that. So there's some really awesome stuff going on in the immunodeficiency category. A lot of times people think of it as immunocompromised, which that's sort of the big umbrella, and then you have autoimmune, and then when the autoimmune overproduces immune deficient, you don't have enough. So mine is a little more common, being that it affects, in Wikipedia, it's like 1 in 25,000 to 1 in 50,000 people. My immunologist thinks it's about more like 1 in 14,000. So I began treatment by April of that year of 2019 and have been on it for the past over 2 years. And I'm healthier in many ways than I have ever been. But one of the things that I went to counseling for in my 20s was anxiety. And I got this and I learned how to manage it. And I have this memory with my own counselor that I value and love the work we did together of I had a sinus infection that just kept going on. And I went to the doctor and I was talking with her about it. And she said, I think you're looking for something at the doctor, but I'm not sure that you're going to find it there. And so the implication in it was that it was hypochondria, that it was just only my anxiety. And so I was like, okay, I kind of internalized that. Like, this is just me. This is just my anxiety. So I did the work in my life to manage that, right? Which was good in terms of helping me in many circumstances, but not at all good in that it taught me to override my own natural, normal alarm bells that were going off with very good reason. And so, after surviving this major illness and getting diagnosed, I really thought back through how my body would, I would get really scared when I would get sick, and my friends knew it, and my husband knew it, and the people around me knew that I struggled with that. And of course, none of us knew that I had an underlying immune deficiency disorder, um, and just thought, well, that's just anxiety. And I look back and I really wish that I could have been like, okay, why are these alarm bells going off? Why am I having sinus infections that last 7 months? What specialist do I need to go see to get this diagnosed? What do I need to do with this information? What evidence do I have that my body is not responding the same as I notice other people's bodies are responding? And how can I get the help that I need? So instead of only writing it off as my anxiety and something wrong with me, to look at what evidence I had for it and then seek appropriate resources and supports to address it. And this also got me thinking too, I've been in private practice, I think it's 10 years this year, with some additional intern hours on top of that in previous years. And I've worked with a whole host of needs. And I can think back to clients that were the identified problem and coming in because they were identified as having anxiety, but maybe there was actually domestic violence going on at home, and they weren't able to open up about that until it was safe enough or until they could be safe enough, but they were internalizing that they were the problem. And so, in the anxiety and phobia workbook, in a lot of this stuff, and in our training, we are taught to look for medical diagnosis first, right? But I don't know that it always happens. We are taught to look for factors that feed into things, but I don't know that it always happens. I think that we often try to just teach the skills to comfort and turn down the anxiety and help someone manage it and contain it, and that there's a big need for sitting with anxiety and listening to it and seeing what evidence is there for what's going on. And again, what resources and supports does someone need to rule out medical causes, to make sure their environment's safe, to see if they need to learn some empowerment skills, to see if they need to learn how to feel certain feelings without internalizing they're bad for even having those feelings. So that shifted things in my own work. And that is a focus of my work, is that I feel like everyone should have a therapist and everyone should have someone that really, really, really listens and helps them to figure out why alarm bells are going off, because anxiety is alarm bells. And it might be that they witnessed something really bad. They witnessed an accident. And so they haven't been able to drive since, because every time they think anything is going to be like an accident, that alarm bell is super, super, super loud, even if it needs to be a little quieter. So there's still value for learning how to calm things down. But there is also still the value for listening too. So I hope that I weave this together in a way that can be beneficial for people in learning how to sit with, how to feel, how to express, how to comfort, how to calm, how to manage, and how to express, and how to get appropriate help with anxiety. So that is the intro. I hope I listened to this and everything sounds good and not glitchy, and I can actually get this out as it's long awaited project of mine that I have told people about, and I'm excited to start getting out there. All right, thanks. Have a good day.